Welcome to Garden of Fertility. I am Opera Stella Thelma, your fertility counselor. Today we are going to be talking about factors that can make a woman to feel pains during sexual intercourse. But before I proceed, I would like you to subscribe to my channel, turn on your notification button so that you'll be notified anytime I upload a new video. To my regular viewers, I say thank you. To my new subscribers, I celebrate you all. Keep on watching. Keep on being a solution. Keep on sharing these videos, and you will be a source of help to somebody outside there. As they say, knowledge is power. Female body are very unique and have its own set of needs. And it is very sensitive. There are some things women need to be aware of about their reproductive system and their private parts. Frequent pains during sexual intercourse involves feeling pains at any point before, during, or following intercourse. So, many conditions can trigger pains during sexual intercourse. For some women, it is an indication of physical issue. Other women may experience pains due to emotional factors. So, therefore, pains during sexual intercourse may need a medical assistant to curb this issue. According to Healthline, there are some things that can cause pains during sexual intercourse. Number one is vaginal dryness. This can be caused by menopause, childbirth, breastfeeding, medication, or too little stimulation before sexual intercourse. That means if you have reached the age of menopause, the tendency that you'll be having pains during sexual intercourse is there, or you are breastfeeding. Medication can also cause it. And also childbirth. You know, when somebody gives birth to a new baby, it takes time for your wound to heal. Either you give birth by cesarean section or normal delivery. You have to give it little times, few months for your wound to be healed. Because if you start having sexual intercourse during this period, maybe 1 month or 2 months to your delivery, it will cause more pains to you. So all these things can lead to pain during sexual intercourse. Number two, skin disorder that lead to ulcer, cracks, itching or burning. Especially when you have itching in your body or cracks. Like somebody who is having itching, when you itch for a long time, the tendency that you may have wound there is certain. When you have crack or wound in your private part, the tendency that you will not enjoy the sexual intercourse is there. So all these things can cause pains for a woman during sexual intercourse. Number three, infection. This infection can be caused by sexual transmitted disease, yeast infection, or urinary tract infection. All this can lead to pains during sexual intercourse. Number four, injury or trauma during childbirth. An accident, hysterectomy, or pelvic surgery. When you have surgery in your pelvic, or hysterectomy, or accident or trauma, or anything that have caused pains before to you on your pelvic region, all this can cause pains during sexual intercourse. Number five, vaginitis. When you have inflammation around your female organ, like pelvic inflammatory disease, uterine fibroid, cysts, and endometriosis. When you have all this in your body, the tendency that you will not enjoy sexual intercourse is there. because there are pains that irradiate from it. Especially when you have a fibroid growth, you'll be feeling the pains during sexual intercourse. Or you have a pelvic inflammatory, that is an inflammation in your body, endometritis, and many more of them. The tendency that you feel the pain is there. Number 6, vaginismus. This is a spontaneous tightening of the muscle of the wall of female organ. When the muscles are tightening, the tendency that you will feel pain during this process is there. Number 7, when you have undergone radiation or chemotherapy, it can lead to pain during sexual intercourse. The last is inability to relax during sexual intercourse. In this situation, women tend to be tensed up and hold their breath, which can cause pains and muscle tension, and also lead to the woman feeling numbness and pains in the pelvic region. In a situation where you keep on having consistent pain during sexual intercourse, there is need to meet your fertility counselor or your gynecologist to know the proper diagnosis you need to go. Many a times, don't take it casual or take it normal. Whenever you start feeling pains, please, you need a medical assistant. Meet your health professional to know what next to do. So, if you find this section informative, please don't forget to like, share, and comment on this video. Thank you for watching.